Okay, one that is on the increase, it would be a protocol issue, but considering they sell it at CVS, they're probably making it into an EMT drug, Narcan. Okay, Narcan is given opioid overdoses, and it is very quick reversal. It doesn't take much at all to reverse the effects of like a morphine, hydrocodone, heroin, these type of medications, right, with Narcan. So one thing that happens with these, so like a heroin overdose, matter of fact, last year, who did CPR on the heroin overdose? Was that somebody in here? Like a 48-year-old male patient came in, he was had a heroin overdose.
We just had the crazy lady.
Wait, you said they sell that at CVS?
Yeah, they sell.
Right, people who like frequently do drugs and overdose, they like have it.
Yeah.
With them, or at least like their friends. Because that was a story with like Demi Lovato whenever she overdosed, apparently her friends had it with them.
Yeah.
I don't know if that was true, but that was.
It's probably is true. They carry around with them in case they overdose. One thing that the opioid will do, it will knock out your respiratory drive, so the patient stops breathing. Okay, so they could be Glasgow with 3. Okay, just sort of like the oral glucose, except that they overdosed on like a heroin or a morphine or something. Okay, so they have this and they suspect a drug overdose, so they can give Narcan. Police carry it in their vehicles now. This atomizer, the way that it's given, you can give it IV, okay, but BLS wise, you can give it through the nose, nasal. The turbinates in the nose will pick this up and it will absorb very quick. Like it says here, it is a very quick reversal of the drugs, and it takes all the high away. So the person waking up will be angry at you because they just spent that money for that high, and they may have spent hundreds of dollars for that high, and you took it away with the 30-cent drug. Okay? Huh?
You said it's 30 cents.
It's about 30 cents. Now I don't know how much they sell it for, but it's cost-wise it's about 30 cents. Okay. Epinephrine is about 33 cents, but they sell it for $100 in the auto injector.
That takes away all of the side effects of like heroin?
Yeah.
Like everything.
Everything. They wake up and they're angry. One side effect of it is vomiting. I have pictures. Projectile vomiting. Lady I gave Narcan to, she vomited. Picture an ambulance, how big an ambulance is, right? She was laying supine at the time. I was trying to get her up. She was waking up. She vomited, and the vomit hit my roof of my ambulance, and it hit the back doors.
Did it hit you?
No. But the first responder I was with that was helping me out threw up all over him. Sprayed him. Me, it did. I had a chunk on my arm. It looked like oatmeal. I was sitting there going, oh, wow, okay.
I would jump out of the ambulance.
But anyway, very, very sudden reversal, okay?
Why didn't they give that at like the hospital?
They do.
Because remember when we had that lady, she was like fighting people, like screaming, kicking.
Yeah,
She was on something. She was on something else.
But here's the thing though, it will only work on opiate-based medications or drugs.
Yeah.
So it won't work on any other drugs. It just won't. They have other, a drug called Romazicon for, like Valium, okay, Versed, these things, they have different medications for that. Alright, but opioids, Narcan, and it's an epidemic, so, I mean, they started having problems with it, so they said, yeah, Narcan, we'll start selling it over the counter. If you take, like I could take Narcan right now, and it would do nothing to me. If you don't have an opioid in your system, it won't do anything. It'll just be like taking water. It's really no effect to it. This you would just spray it in the nose, okay? So you take.
You're not putting that in my nose.
Take one for the team.
I don't want things in my nose.
So you just have this combative patient, okay? And huh? It fits in the nair.
Yeah, I just don't like.
And then you
Ah!
in the nose on the thing.
Thank you.
You're welcome, Mama.
Thanks.
Drink?
I'm just okay right now.
Nope, now you
Oh.
are. But and you just squeeze it, push it. It's a pre-filled syringe. The average dose is it can go up to 2 milligrams, but the average dose is only 0.4 milligrams. So it's a very low dose, but offers a very quick reversal of it. This is probably the way that you would administer it BLS-wise if you had the opportunity. So Narcan reverses opioid overdoses. Medications, chemical names, who can tell that, right? You have a generic name, you have a trade name. You need to be familiar with most of all the names, like epinephrine, adrenaline, right? They have the different names to them. So don't be like the person that this real life happened, ALS, person having an allergic reaction, got mad. I knew this because I was the supervisor of this former employee, and he got mad because he didn't have any Benadryl in his drug box. All he had was diphenhydramine. What's the problem with that? He didn't have any Benadryl. This patient having a bad allergic reaction. All he had was diphenhydramine. What's the problem?
Wait, first of all, wouldn't you give epi for the allergic reaction?
Now this, you're going to give this. Why is there no problem? It's the same what?
Same thing.
It's the same medication. Diphenhydramine and Benadryl is the same medication. It's a different name. The person just didn't know the other name for it and didn't think he had any Benadryl, but he had diphenhydramine. That's the way it's labeled on the vial. It's diphenhydramine, but it's Benadryl. So you have to know both forms when you're talking back and forth about the drugs. Very important. Okay. Here's just a flow chart. It tells you what it's used for. This will be in your book. This is something that you would want to spend some time studying. Okay. Like nitroglycerin, nitrostat, nitrosublingual spray, right? Chest pain. See the different names for activated charcoal. Yeah. It's super char, okay? Alright. Instant glucose. There's nothing for oxygen, right? Epi, adrenaline, EpiPen. We get down to Zopanox. The Z, the X is pronounced with the Z, okay? This is the same, it's a beta-2 agonist, it's the same as albuterol, okay? Albuterol is just cheaper. So on the ambulance, you probably have albuterol, okay? If you look here at this word that I've never been able to pronounce, ipratropium bromide, all right? This is why I enjoy having two names to the medication, so I don't have to say that one all the time. Because it's called Atrovent. Is this medication here? That's why I call it. You say, like, what's that? You look at it. Word recognition is important. Okay, so you look at, oh, that's Atrovent. Atrovent. What it does is you can have it in a neb, duo neb. So like this one, this is Atrovent here, okay? It's in the same container as the albuterol, top container. But what you do is you have an A, you might give the patient an A and A, and they may be already mixed together. If they're not, you can mix them in the same container. So you put your albuterol in, you put your Atrovent in, get the A and A, right? Sometimes they're mixed together, sometimes they're not, but they work very well together. Most of the time they're given together, okay? The Atrovent decreases secretions. It causes a drying effect, okay? So this patient with this chronic bronchitis and even in asthma, you have a problem with excessive mucus, right? Production at the bronchioles. So it decreases the secretions. It has a drying effect to it. This would be Atrovent would be a protocol issue. Most of the time in testing, you're going to see just albuterol, aspirin, Bayer, obviously, right? These different type of aspirins that we get.
Why? Why do they have so many names? I don't understand that.
I don't either. But anyway, the route is always important. So we look at sublingual for like nitroglycerin, oral for the oral glucose, and activated charcoal, inhalation for the albuterol, intramuscular. We don't really give anything BLS-wise intramuscular, okay? But it's it's in the muscle, okay? So if we look at these routes and then the onsets of these as well. So sublingual is a very quick onset. Oral, slow onset. Inhalation, very quick onset. Intramuscular, it's a quick onset, but not as quick as IV, but it's longer lasting. So if you give a medication in the muscle, it's going to last, the effects are going to last longer. But like I said, it's not a BLS. We don't give intramuscular injections BLS wise. Intranasal, any questions there with intranasal? She's not paying anything. Yeah. No. In the nose, right? Subcutaneous, the epinephrine, this way the auto-injector is given. It's given subcutaneous in the fatty tissues. If we were given that by needle, we do the injection, but with the needle at the 45-degree angle, right? Okay, these are just different forms. We'll flip through this quickly because we've already talked about it. The pill form is obviously a compressed powder. There's the chewable aspirin, 81 milligrams. All right, so we give 4 of them. Liquid, the EpiPen for the auto-injector. The gel form, like the glucose. Okay. Did y'all have a question? Question?
No, I was explaining.
Okay. Suspension would be the activated charcoal. It's suspended in that in the water. Okay, the mixture. And then there's another form of activated charcoal. And then the meter dose inhaler, like we have here, and then the nebulized mask, the setup. On an ambulance, in the package is what I call the peace pop part of it, right here. But just so that the patient doesn't have to hold it, we just go ahead and put the mask on. It's more convenient for the patient not to hold the mask. Gas, obviously oxygen, right? Spray, as far as if we sprayed the nitroglycerin, like the form here. This is the pill form, the spray form. And then this is what you need to know for all the medications that we talked about today, okay? You need to know the indications, why you give it, contraindications, why you don't give it, okay? The dose, put route here as well, dose and route. Well, this would be the route. Never mind. Administration. Okay, so the route, actions, what it's supposed to do. Okay, and then side effects. So what I would suggest that you guys do is just make drug cards with this information on there. Just pull it out of the book, write your drug card so you can study. That's the best way to do it. But definitely be responsible for that. So we know all this. We just talked about it. How it works, the mechanism, how the drug works, the action of it. What type of response do you want from it, okay? And then the side effects. There should be unpredictable side effects to a medicine. You should know your medicines well enough where there's no unpredictability of the medicine, okay? What's the however, what's the unpredictability of nitro? Yeah, it may not work. You may be spraying it on somebody's head instead of sublingual. Or what? What's unpredictable about nitro? I'll give you a hint. This patient has a blood pressure of 148 over 90. Now, can they take a nitro with their blood pressure? Everything lines up. Are they okay to take nitro?
Yeah.
Okay. So what's the unpredictability of that?
It raises the blood pressure.
No.
I don't know. It's unpredictable.
No, it will decrease the blood pressure. It's a vasodilator, like that. There you go. The unpredictability. Because we loop back to the physiology that we sort of picked up last year with Darcy's Law, right? Any change in resistance causes a drastic change in blood pressure. So you can have this one patient, okay, that has 148 over 90. You administer them one nitro tablet, and all of a sudden, let's say they're 70 over 40.
What?
Yeah, ouch. Right here. So, if you're administering nitro, the patient's probably if they have a cardiac history, they've already taken nitro. So, using that critical thinking skill, what would you ask them?
Have you taken a medication?
Exactly. Yeah. What kind of effects does nitro have on you? Right. Have you had any adverse effects with nitroglycerin? Because it can drop your blood pressure a lot, right? I've seen it. So, fortunately, ALS, on my side, I just pump them full of fluids and get their blood pressure back up. It's not really that big a deal. Except we dropped it so quick and, like stroke. But anyway, so there's some thinking in there as you work through the medications. Okay, it's not that common, but it is a possibility. Okay, so the things that you want to do, if it's not a standing order, you have to get medical direction from it. Make sure that you have the proper medication. Can tell you a list of stories about people given the wrong medication because they don't look at it. Verify, okay, if it's the patient's, verify that they have a prescription for it. Check to see if it's expired. Thanks to Twitter. Now we don't, if the medication's expired, we don't give it, right? But I read an article, because I get the health news through Twitter, and that they believe that some medications, you can take it up to 15 years past the expiration date.
What?
The strength of it wear off?
and some of it doesn't. Some of it does. Yeah, but some medications don't. I've had doctors, ER doctors, I mean board certified emergency doctors, all different doctors tell me that it's very safe to take medicine a year after the expiration.
Like what?
Any. Now there's only a couple that you can't. That's like for seizure medication, you wouldn't take that after the expiration. But most medicine, like Tylenol, you know, you buy that huge bottle of ibuprofen or Tylenol that you don't ever use for something. You can. I always go a year past the expiration date.
Those ibuprofen like a bag, like I have some like backpack. I don't know when those expire.
Yeah,
How
just
long
keep,
they've been
just,
in.
hey, if it doesn't work, take one. But yeah. So the yeah, but anyway, I remember that when I seen the expiration date. I mean, they're saying, and some of it never has any. Nitro, I think nitro would lose its effect. Did you spray me with that nitro? I got a headache. I think you did. I got a little headache.
Then you walked through it, and then you went, oof, and you came back.
Yeah, that's true. No, okay, could be my fault. All right.
Maybe not, but.
Yeah, maybe not. So, gotta blame it on somebody. Might as well. Okay. Check, make sure it's not discolored, there's not floaties in it. Right, make sure it's the right form, route, dose. The 5 rights is coming up here in a minute, and then document the administration. Okay. If you get it through medical control, make sure that you verify. Remember, we talked about that. If you get a medical control order over the radio, make sure that you verify the order. Everything's recorded, so you verify the order. All right. If you have to get it online, if it's not a standing order, okay. And then be familiar with the names, the different names of the medicine. All right. And don't administer them if they're expired. They shouldn't be on the ambulance if they're expired. That's a big deal, carrying expired medicines on the ambulance. If you get inspected, you get in a lot of trouble there. Okay. Cloudy medicines, discolorations, floaties. Make sure you're giving it the right form, the route, the dose. And then the 5 rights. You should only have one patient. Okay, so that makes it a little easy. Who's the patient? It's one person on the ambulance cot, right? The right medication. Make sure that you're giving it the right route. I had a partner save me one time. I was about to give an IV medication that was supposed to be given sub-Q. And I was really sleepy, so I think I was giving it. I was about to put it in the IV. My partner goes, "Hey, it's not giving IV." Oh yeah. Give it sub-Q. The side effects of giving it IV is just ventricular fibrillation. No big deal.
Oh.
That's not a big deal.
Yeah.
That one would have done.
It doesn't hurt nobody.
I'd shock them back into life, right? Alright. Make sure you're giving the right dose. We talked about that earlier. And then the right document the time. Make sure you have the right time on it. Okay? So you document the drug, the dose, the route, the time, and then you whatever the patient's change was. Okay? So this is critical in giving medication that you document all this plus whatever it did to the patient. So if you give nitro, they start it. This is why you have to have a baseline. You start at a pain of 10 over 10, and you give one nitro, and it's 5 over 10. You document that pain, change, 10 over 10 to 5 over 10, right? So you document the change in it. And then you just reassess. You start reassessing down the ABC, blood pressure. You want to make sure there's not any side effects that you're not aware of, or something may happen to the patient. Right? SpO2, just do a good reassessment after you administer medication. And then now drugs are great. We used to carry these big, huge books around. I think I still have some in my man purse in there just to give it some weight. Now everything's an app. I mean, you can get different apps for medications. You can get the whole drug book on your telephone, and you can pull it up. So it's very good. The technology is great as far as medicine's concerned. You can get apps to help you do assessments. You can get apps to figure out drug equations. All these different things that we had, all these books and all this other stuff too, it's in the phone now in apps. If you can think of it, there's probably an app for it. So there's a lot of apps out there for medication. I use this, Hippocrates. I mean, way back in the day. Have you guys ever heard of a Palm Pilot? Look it up one time. You have to search Google for it, because when Palm Pilots came out, that was it. We thought the world was coming to an end. It's just this little flip-up sort of thing that had a few, sort of like what apps are now. Look it up.
It looks like a little toy.
Palm Pilot.
Yeah, like it's like a palm.
And it would, P-A-L-M, palm. And you could, yeah, I still have one.
Of course.
What?
I don't, I think it still works, but put batteries in it.
Is that how you get your wife?
Huh?
Is that how you get your wife? You just don't know how to.
No, I used it on the ambulance. When that came out on the ambulance, a bunch of people got them. They had that green screen. The first generation had that green sort of screen. Then they got color. Yeah, I couldn't afford the color one. Yeah, that was the first generation.
Oh no!
That was the second generation, I think. Then they had a color one somewhere down. Yeah, you could put all your phone numbers in it. Yeah, I couldn't afford that one. Anyway, to show you where, I'll have to bring it in one day and we'll put a battery in it, see if it still works. But I kept all this old technology. I have a pager still back in here, and this Palm Pilot. It's crazy. But you guys are fortunate to have the electronic devices and different things. Now, the protocols are like listed in sort of a PDF form, and they have them where you can download them to your phone. And let's say you have a heat-related emergency, you can go to the index and they're linked, and you can hit it on the index and it'll scroll down to the heat-related emergency page. So instant access to it, right? Before that, we had a book like this thick, we're flipping through it. Where's the H's? And having a look. So, healthcare-wise, technology has really done good. We used to figure out drug calculations on paper, and of course we still have calculators, but we figured how to write them down on paper. Now you just enter the amount that you want, the amount that you have on hand, and the milliliters that's in it, and it spits out an answer for you. So, we did have to think a long time ago. We had to write it all on paper. I remember using a piece of paper to figure out the Parkland burn formula on a burn patient, and I'm sitting there doing the math. Now you just plug in numbers on an app, and there. Same way with that GCS that you guys have to learn, Glasgow Coma Scale. We'd have to figure it out looking at charts. Now you just plug it in on an app, and it gives you the instant answer. So look through your phones later when you search what's that the Apple Store, and just like top in medical apps, and a zillion of them will come up. There's apps in there for this class to to have questions, to get questions on stuff. A lot of different things. Okay. Any questions? Everybody good on Pharmo?